So my name is Blanca Paniello. I'm from Barcelona, Spain, and I have studied here biomedical sciences as my bachelor degree. And yeah, this next year I will move to Sweden to study my master's degree in public health. And yeah, like overall, I will define myself as a global public health enthusiast. So I learned about the network thanks to some friends, because I previously worked in different NGOs and I finished working there and I was like, okay, I want to continue working on global health in the volunteering section with NGOs and everything. And I had some friends that are working currently in the network, and I was like, oh, like, what are you doing? And like, what it is all about. And yeah, I really liked it and I jumped in directly. So as I said before, I studied biomedical sciences in the University of Barcelona, and I have been working in different research institutes. And right now I'm in a hospital here in Hospital Clinic. Working in the research department of the addictions unit in the Department of Psychiatry. So yeah, like we are working with European and national projects regarding mental health, addictions, but also COVID, how everything is interrelated and everything. And apart from that, I'm also working in the network as the partnerships coordinator, also like managing how we can approach different stakeholders and work together with them, collaborate, etc. What else? Then afterwards, I'm also working in different research and advocacy projects, but that's also like a volunteering thing, mainly focused on gender and climate change. And yeah, I will say that for now, that's mainly it. But yeah, as I said before, I will be studying or I will be starting my master's degree in Stockholm in Sweden this next August, September. I studied biomedical sciences, and when I started in the university, even before that, actually, I always had the feeling that I needed to help somehow apart from my scientific background and what I could do with that. So I decided to go for a volunteering project that a friend had in the Western Sahara refugees camps in Algeria. And we started an organization from that sanitary dispatch, or like that project. I went there for twice to that refugees camps, and in that moment I think that I realized that I actually wanted to, apart from research and like the basic research of biomedicine, I also wanted to help people more directly, to have more contact with people in a populational level, not only in the biomedical one. So I think that everything started there when it comes to global public health. So we founded that organization that is still running. It's called FAUDA, which is, how is it? It was Freedom or something like this, like the name itself of the organization. And then afterwards, I also jumped into different NGOs that made me realize that actually global public health was actually the career path that I wanted to follow. So I first work in AIX, which is the students, the healthcare students organization here in Catalonia and the Balearic Islands. And I worked there in the public health standing committee. And then afterwards, I jumped into the international level with IFMSA, the International Federation of Medical Students Associations. And I worked there internationally, well, in different global positions for 2 years. So yeah, like in that moment, like everything happened during my bachelor degree, during these 4 or 5 years. So during that period, I think that it was just like too clear for me that global public health was actually the career path that I wanted to follow. So yeah, like then afterwards I graduated from my bachelor. I started working in different public health projects, and yeah, now it's where I am right now. So I think, or at least that's what I think that it has worked with me. But I think that passion is everything. And to be able to translate that or to show that in an application, it might be a bit difficult. But I think that if you are able in the end to show how much you want to work in that and how much you believe in that project, I think that that's what it will be valuable from anything that you can present to people. So first of all, passion is everything for me, or at least that's what I will evaluate the most from an application. And then afterwards, I also think that everything is in the end a story. So, and I really believe in storytelling techniques and this kind of stuff. So when I need to write an application, I always think about, okay, like what I want to explain to these people. Like, first of all, of course, like what's my background, why the learning experiences that I have had have led me to this point. But then afterwards, what's the reasoning behind these learning experiences for me to decide to apply for that, which is the story that made me apply to these and think that I was suitable for that position. And then meanwhile, of course, like showing that you really want this, and you want this because you believe in this and you have this and this idea. So showing off your passion in that sense. So yeah, like I will say that these will be like my advices, or at least how I think that it has worked in my case, to show your passion, and then afterwards to show your story as well, to explain it in a story-like way. I had some doubts about whether I will be able to translate my experience in biomedical sciences to global public health. Because in the end, if we are looking to the whole perspective, when it comes to like medicine or biology or whatever, like biomedicine is a very basic discipline, whilst global public health is like the contrary one, the most population-based one. So I was like, okay, like perhaps this is a con from my side. But then I realized that perhaps it will be an advantage as well, because this helped me to have a very holistic view of how health impacts people's lives. So from molecules to a population-based approach. I think that that's how my studies helped me to understand how I could reach my ultimate goal, which is in the end, like I think that the ultimate goal of everyone who's working in global public health is to make people to have healthier lives, right? So I think that with that approach and having that perspective in mind, and knowing that everything needs to be applied to people, like any kind of research outcome, any kind of policy approach that you might have been working for the last 3 years or whatever. Everything needs to be applied to people and needs to have this sociological perspective of how we can help people with what we are doing. So yeah, this holistic view, I think that helped me a lot, or at least helped me to know where's my place within global public health. Okay, so for me, global health means to provide fair opportunities to everyone when it comes to healthcare, but also related to other factors. Because when we are talking about healthcare, we are also talking about education. We are also talking about the resources that people have, even the politics and how justice plays a role there. So I will say that for me, it's about securing that there's equity in every single level of our population. And of course, afterwards, it will apply to the global health arena or like healthcare topics. But I think that equity is actually the foundation here. Even in the individual level, but also in the collective level when we are talking about healthcare. So for me, global health is about that, about having fair opportunities to everyone when it comes to healthcare, but also involving all the factors and determinants that impact healthcare and its access, right? So yeah, for me, I know that it's like very abstract, as global health is actually, but it's all about that equity. I will say that to find your place is something very important. And when it comes to finding your place, it's also about having clear goals of what you want to achieve. So that's why I also, for instance, started working after my bachelor's degree before jumping into the master's degree, because I also wanted to have a perspective of how the working environment works as well when it comes to public health. But also which are the topics that I like the most, how I can contribute better to the whole mission, right? Because sometimes it's easier to jump from one degree to another, which I think that it's also fine, because like it gives you like more knowledge and more background when it comes to start working. But in my case, I think that I prefer that just to have a clearer perspective of what I wanted to do. Although I was like super like 100 sure that I wanted to work on global public health and even the topic itself, like social determinants of health. But even within social determinants of health, like there are many topics. So it was all about, okay, like this is the topic that I want to work on, and these are the goals that I want to achieve as well, professionally and personally, because like both things are play a role like at the same time. So I will suggest this, to have a clear goal of what you want to achieve, and then taking into account that, as we said, global health is a very abstract discipline. It will be also great to start building your career into the things that you would like to get specialized. Because sometimes, yeah, like even in climate change, which is like a concrete topic within global health, it's like, yeah, climate change, I want to work on climate change, but do you want to work in the policy area with like working with the COP and working in the, I don't know, like writing process of NDCs, or like what? Or do you want to work in research adaptation of climate change measures, or do you want, you know, like there are many things to do. So perhaps it will be about trying to find your place in the area that you would like to work in the future, as well as setting your goals that will be serving you in the future as well, to see, okay, like I have achieved what I wanted to achieve.